So what's happening with him is, the reason I asked about his heart is because, just hold that thought. If you see heart up here, 11 to 1, the opposite of the heart is the gallbladder. So if he's having problems down, have y'all seen the meridians? Do you know anything about the meridians? Okay, well, that's okay.
Can we talk about that?
That's okay. So the gallbladder meridian runs down through here. If the heart is weak, gallbladder will show out because it can, which would be sciatic. Now on him right here, all I'm doing is rubbing the heart meridian. You feel that, right?
Yes, I do.
To calm down the gallbladder. Because a lot of times when people are in pain, they don't want you to touch. They don't want you to touch them where it hurts. You'll get a lot of that, especially with shoulder stuff. And people are older or they just had surgery. They will not let you touch them there. They're like, which is fine because there's a lot of other points for this shoulder. If y'all want me to, I'll show you that just for a moment. So you feel that, right?
Oh, yeah.
Yeah. So when you get sciatic pain, you need to rub on this. All I'm doing is, yeah. Okay, so that's for the sciatic. Now let's deal with the back pain. You guys will use this forever if you remember. So one of my mentors is Dr. Tan. He passed away last year. One of his lower back points is this. You feel it?
Yeah.
And you never see the look on Chad's face either, so.
Yeah, so if you press on this and see what you've got is a little bit of, when they did the surgery, what did they do? You've got like some impingement or there's a spacing issue.
The nerve root is compressed.
Okay, so if you or someone that's angry with you presses on this, you can actually separate. This will help separate what's back there. Because you can feel that little thing click. Feel it? Yeah, that's like some kind of impingement.
So, someone who is angry with me?
Someone who's angry with you is going to really dig in like, okay? So I would do some of that number. And then we'll pass around the ear and let's see if somebody can figure out what that spot is up there. And we'll come back to that. You guys need to come up here and look at this, all of y'all. Yeah, this is an interactive class. So, you don't mind me, because you're perfect for this. Well, actually outstanding. Perfect is beneath what we're going. This is lower back. You see that right there? You could diagnose him just by his ear. You see that little red line? So in acupuncture, he's perfect for learning ideas because you take a needle and you just stick it right in there and release that. And you guys know all about release, right? Yeah. You would stick a needle right in there and release that, boom. His pain would be 10, 20, 30% reduced. Yeah. That's lower back. Yeah, I didn't even have to ask him all those questions if I just looked at his ear. Any questions? So that's why that ear that we're passing around, that ear is really important. I'll try to get you a picture of an ear because they're hard to find.
What?
I'll try to get you a picture of an ear because you can diagnose a lot by the ear. If people think you're really smart, all you're doing is you memorize pictures of the ear.
Well, people last week were talking about pull your ears and it makes it really so like your jugular vein, it like opens that channel up.
Yeah, it rights you. And you know, like the gallbladder and the small intestine in right there. But okay, you have any questions?
Just a little dump down right now.
Okay.
But are you done?
Yeah, for now.
For now.
Yeah. You're welcome. All right, so everybody see why the time is important, just because it gives you some ideas. If people have, a problem that only lasts between like 3 to 5 or 5 to 7 in the morning, then you kind of know already what organ is affected. You just don't know if the organ is deficient or if it's in excess, as we say. You just have to ask a lot more questions. But yeah, this chart, that's really the only thing I use are the times, just because they're really helpful. Okay, anybody have any questions about anything so far?